Welcome back. Seasonal allergies are also known as hay fever or seasonal allergic rhinitis. These symptoms occur at specific times of the year, typically when trees, grasses and weeds release small pollen particles into the air to fertilize other plants. To further divulge, general practitioner Nelson Makemba now joins us. Doctor, good evening and welcome.
Good evening to you, Nina, and good evening to our viewers this evening.
Thank you so much for being here. I mentioned, of course, some of the reasons why you would have seasonal allergies, why they occur. With these grasses and trees releasing small pollen particles. But I want to know, are there any other causes of seasonal allergies, doctor? And also, perhaps, what makes one more prone to allergies? Because some people have them really bad, some people not at all.
Yeah, pollen is probably one of the one that's probably implicated the most. Grass, weed, mold, and dust. These are probably the particles that, if one exposed to is probably likely to, mount up an allergic reaction. Oftentimes, it's a function of an immune system, where some people, they just have this overly sensitive immune system that tend to react to such, particles when exposed to. So that's why you find few people will have it really bad, like I've highlighted to earlier. Some probably milder form, and some people just don't have any problem at all. So it's really a function of the immune system, how it reacts when the body is exposed to these said particles. Yeah.
Mm-hmm. And how do you approach the treatment, doctor, of severe seasonal allergies?
When somebody is having rather a severe type of a presentation, that's somebody that might need to be seen in a hospital setting or in an emergency unit, such as a casualty. Now, depending on the symptoms, just as a person presents to the facility, what a clinician or a doctor is likely to do, they'll probably do a quick evaluation. They might want to look into the throat to see if there's a swelling. They want to look if they are itching and they're having rashes all over. They probably would want to listen to the chest to see if there's any wheezing or so. They might also complain subjectively of a shortness of breath. You might want to put a pulse oximetry to check their saturation just to see if they are getting enough oxygen in. The probably initial approach will be establishing an intravenous line and then giving some steroids or antihistamines that sort of help to dampen the reaction. We do also see sometimes if an individual is really having a bad reaction, they might develop what we call a laryngeal edema, where the larynx become edematous. When that happens, that really compromises the respiratory system. In an event of that nature, we might go and do what we call a tracheostomy, where we slit a little hole in the trachea and push in a windpipe that goes into the lungs to help them breathe, as we are then, running in the intravenous line to help, bring down that swelling. In a severe event, that's probably one might do. And you might also nebulize them, where you put them on a face mask and you give them some nebs, depending on, what choice of nebs that you're going to use. As they inhale that nebulized, mist, it sort of get into the lungs, help to, vasodilate their airway and then open up so they can breathe with ease again.
Would the average case present with different symptoms? And let's talk about what those symptoms can be and why they often are almost flu-like.
Yeah. Primarily, individual might come in with a sneeze. They might just be itching, particularly in the roof of their mouth, itchy, watery eye. It's probably irritation in the nasal passage. They might have a cough, and they might also subjectively tell you that, they have shortness of breath. And rashes on the body, particularly the itch, and when they scratch, sort of a skin rash eruption take place. Those are probably the commonest kind of presentation that you tend to see. Now remember, this seasonal rhinitis or hay fever tend to also affect the upper respiratory tract system, the upper airway from the throat upward. That is really the same place also where you find all these common cold viruses, affecting the area. That's why you find the whole sneezing, coughing, runny, blocked nose, These symptoms really might, be the same kind of clinical presentation that you tend to see when somebody has a common cold. And that's probably the reason why the two oftentimes, present in a similar fashion, because it's the upper airway that is often involved.
During which months do these seasonal allergies peak? Because from what I understand, you can experience symptoms all year round.
Yeah. It depends from individual to individual. Some people might have it all year round, particularly in between changing of seasons. But primarily, you know, those that have it bad, probably they might have it bad in spring and in summer and in winter as well. Those are probably, you know, the three major seasons where you probably see people, you know, oftentimes complaining of the kind of presentation that we tend to see.
Talk to us, doctor, about how you would manage patients with multiple allergies, ensuring a personalized, treatment plan that includes medication and lifestyle changes.
Yeah. The approach is basically that of, you know, taking a good history from your patient, trying to understand really, you know, the kind of symptoms that they tend to present with, and the kind of environment that sort of trigger the symptoms, so that you at least have a mental picture of what, you know, you're dealing with. We also do run some serum tests where we can draw blood and then send that blood off to the pathologist. They are then able to, you know, sort of, you know, test, you know, their reaction to different types of, you know, particles that we tend to see commonly causing these problems, such as pollen, grass, animal furs. They might even do a food allergy where they can test particularly against seafood and all these kind of things. And then when you get that, you know, itemized report sent back to you from the laboratory, you are then able to sort of, you know, isolate, you know, the particles that might not be giving that individual problems and those that do give the problems. And then once you establish that, you know, you can then, you know, sort of, you know, look into the environment. If maybe somebody is allergic to dust, now we have to talk about, you know, if you got a mat at home, it's probably better to take the mat out and then have the tiles in. If you have curtains, it's probably better to remove the curtains and then you put some, you know, blinds on. And the type of beddings, you probably need to use flat sheets rather than feathery sheets, because those tend to attract dust. Those are just some of the lifestyle kind of modification that one can come up with. And obviously exercises has been actually proven to improve one's, you know, betterness and, you know, dampening the response to these kind of things. And then the drug therapy really across board, it's probably, you know, the same molecules that we use, antihistamines, steroids. Some people that tend to have these typical skin rashes, you might give them a topical steroid where they can apply it topically. That might be given PRN, in other words, at the time that the reaction is taking place. Nowadays, we're actually becoming smart. Sometimes we mix up the lotion with the steroids, so that then becomes a cream that you apply on a daily basis. So there's already some steroids in that cream that you're applying, so to an extent you are protected. And, you know, when you do approach it this way, your clients or your patients tend actually to do very well. In clinical practice, we have seen once we do this kind of things, people actually stay symptom-free for the longest of time.
And what a relief that must be.
Yeah, definitely. You know.
Thank you so much, Dr. Makemba, for joining us. Always lovely having you here.
It's always a pleasure being here. Thank you for having me.
That was Dr. Nelson Makemba speaking to us about seasonal allergies.